Thank you. A little more about CBH. We serve 160,000 kids and adults in Maryland. Dr. Ronnie talked about cost effectiveness. Since the recession started, the community providers across the state, many represented here today, have served 70,000 new people. The enrollment in the public mental health system grew from about 90-some thousand to 160,000 today. That's like a 60+% growth rate. Expenditures during that time went up about half that rate. The average per capita cost of people using our system is lower today than it was in 2004. I don't think you get more cost effective than that, but we're kind of at a tipping point financially. And the message today is meant to reinforce a message that all of our members have been sending to Governor-elect Hogan since he was elected, and that is, A, support community behavioral health services, sustain an inflationary rate adjustment that is supposed to take effect January 1st of 4%. This increase is due to a piece of legislation passed in 2010 that requires that these community behavioral health programs be treated the same way hospitals are, managed care organizations are, nursing homes are, in that every year their rate structure is adjusted for inflation. It seems sort of a fundamental part of financing of a vital safety net service like this, but it has not routinely been the case. In the last 18 years, these programs have had inflationary adjustments in only 5. That's 13 out of 18 years with 0 inflationary adjustment. So the number one request we're making to the governor-elect is sustain that 4% increase that's taking effect July 1st and follow the provisions of the legislation from 2010 and make sure these agencies who do the great work you've been hearing about get the kind of increases they deserve year after year. In the press packets is a little information to support what I've just said. There's a history of inflationary adjustments or lack thereof with a lot of zeros on it. There is also a little document called A History of Neglect that talks about how historically and traditionally these services have not been well supported by the state budget. An example, in 2011, the legislature passed a bill increasing the state alcohol tax. Initially, that alcohol tax was supposed to support a number of human services. 15% of the proceeds were supposed to go to mental health, 15% to substance use services, 15% to developmental disabilities, and other percentages to other parts of the healthcare system. When it was all said and done and amended, mental health ended up getting 0, substance use services ended up getting 0, developmental disabilities got, I think, 12 to 15 million. But most of the money that was initially earmarked to be spent for human services ended up going to school construction. And we have it on good authority that some of our money went to put AstroTurf on 2 football fields in Howard County. But that kind of neglect has to stop. And that's why we're appealing to the governor-elect and his new team to sustain and increase and improve the support these vital programs get. That's my message today.